Healthwatch Leeds. Inclusion for All Action Hub. 16th of July, 2020. Zoom meeting. Attendance. Name, organisation and job title. Tatum Yip, Healthwatch Leeds, Community Project Worker. Stuart Morrison, Healthwatch Leeds, Team Leader. Christina Koslowska, LTHT, Head of Patient Experience. Charis Green, LSD BP, CEO. Sharon Moore, Lead CCG, Equality and Diversity Manager. Helen Butters, Lead CCG, Communications and Engagement Team. Julie Royal Evett, LYPFT, Strategic Health Facilitator. Mark Healy, Advocate. Elaine Ray, LCC, Adults and Health. Jez Coram, Forum Central Development Worker, Learning Disabilities. Madeline Fahy, Connecting the North. Becky Hainsworth, Leap One Deputy Manager. Parveen Ayub, HWL Community Project Worker. Wendy Cork, Advocate, Advocacy Development and Partnership Director. Saeed Ahmed, LYPFT, Patient Experience Lead. Jenny Wilson, LTHT, Project Manager. Fiona Coop, Lead CCG, Primary Care Commissioning Manager. Jesselyn Mahoney, Leads Public Health, Adults and Health Directorate. Peter Lomas, People with Living Experience. Claire Nixon, Advocate. Victoria Tredenick, Leads CCG, Commissioning Manager, Learning Disability and Autism. Philip Hawley, People with Living Experience. Hannah Davis, HWL CEO. Alison Conyers, LTH, Lead Professional, Learning Disabilities and Autism. Owen Walker, Autism AIM Manager. Apologies. Name, organisation and job title. Holly Danhauser, Lead City Council, Health Partnerships Team, Partnerships Development Manager. Jason Hickson, LSD BP, Chair. Jonathan Phillips, Healthwatch Leeds Board Member. Rachel Koivunen, People in Action. Karen Fenton, Forum Central, Mental Health and PSI Development Worker. Howard Beck, Lead City Council Commissioning Manager. Hayley Miller, Leads Care Record, Informatics Project Manager. Abbreviation list. Accessible Information Standard, AIS. Healthwatch Leeds, HWL. Leeds Hearing and Sign Loss Service, BID. Leeds City Council, LCC. Leeds Community Health, LCH. Leeds Teaching Hospital Trust, LTHT. Leeds and York Partnership Foundation Trust, LYPFT. National Federation of the Blind, NFB. NHS Leeds, Clinical Commissioning Group, Leeds CCG. Terms of Reference, TORS. Leeds Care Record, LCR. Friends and Family Test, FFT. Leeds Society for Deaf and Blind People, LSDBP. Part 1. Organisation Update and Progress on Actions. Organisation, LTHT. Progress. LTHT Patients' Experience team shared some great work that the team have been working on to address the issues raised by the deaf people at the last meeting in May. Silent animation for deaf/HOH people based on feedback from Inclusion for All. Sensory awareness magnets are mentioned in the video. These are used on wards to identify communication needs. LTHT's ward iPads all now have auto transcription app. Video calling app also now available, can be accessed by BSL interpreters. Befriending scheme set up with LSDBP for people in hospital. Text phone system under development for PALS. Development underway to enable deaf patients to access TVs. Hospital communications book under development to help deaf people to communicate while face masks still mandatory, will include pain scale, basic needs, etc. Video interpreting still available on wards for foreign language and BSL. Had 25 units pre-lockdown, now increased to 50. Face masks issue. Looking into options for transparent masks to facilitate lip reading, bearing in mind these aren't currently considered safe for use in hospital and are impossible to procure at present. Organisation, LYPFT. Action. Currently conducting data capture exercise. Old system of data collection gathered info, for example, that people require contact by text, letter, etc. New system captures more info, for example, about carers, ethnicity, etc. Action plan for AIS that was developed in March is now being implemented. Training for staff. This module is being developed in co-production with BID. Spotlight on our services, deaf, CAMHS, and learning disabilities, inpatient service. Organisation, Leeds CCG. Action. New Access for All action group is being formed within the CCG to replace existing AIS workgroup. Will go beyond AIS to include people whose first language isn't English, etc. Reference to AIS made during briefings. Have considered effectiveness of recirculating AIS posters and GP surgeries in City. Currently on hold because patients are accessing GP surgeries in person much less, but will provide surgeries with an electronic copy. Has fed into People's Voices Group Digital Inclusion Report and done own studies into digital exclusion. Work being done to ensure digital services are as widely accessible as possible. For example, laptops distributed to surgeries for use of webcam. Standardizing information for patients as extensively as possible. New contract has been awarded for both BSL and language interpreting, but new service was put on hold because of pandemic. Go live scheduled for 1st of September. Organisation, Leeds City Council. Action. System has been in place for a while to produce quarterly reports, so service user data is in place, although it may not always be the data required. Coronavirus crisis has revealed the importance of having resources to hand quickly. System is now in place to check whether the data LCC has is being used helpfully. Plans remain in place to promote AIS among community. More thought needed as to how this will be done. Organisation, Third Sector. Action. Forum Central leading on communities of interest work, linking communities with key decision makers. Feeding into People's Voices Group Digital Inclusion Subgroup, assuring people's access to digital services, and 100% digital, sensory impairment and digital inclusion session attended by 90 people. Scope have provided guest blog about changes to their helpline during COVID-19. Tuesday Twitter Takeover has given different third sector organisations the chance to use FC's Twitter to talk about their service users' accessibility needs. Organisation, LCH, Action. Focus on COVID-19 response, but still aiming to implement AIS across the service. May include working groups when capacity allows. Project on Health Inequalities has written a paper which will be sent to Trust Board. Updating website to reflect services ambitions post-restart. Has been working with communities of interest to hear feedback. Reflections on progress so far. Main challenge isn't so much with processes and systems, it's about ensuring needs are met when patients come into contact with individual providers. Sometimes a lack of complaints to providers is used to suggest that there isn't an issue. LTHT to do another check with public in 12 months' time to see how changes are working for them. Further standardisation required across organisations. Is any work being done to reassure people who might feel extra nervous about attending health checks? Wendy to follow up with Julie after the meeting. Part 2. Experiences of people with learning disabilities. Peter's experiences. Being a member of different groups, for example Elite 1, helps Peter to get information about how to access healthcare. Everything's closed at the moment. You have to go private. Keep Fit things are opening. Museums are opening. If services are shut, what are the alternatives? Lead CCG notes that surgeries are open and can be accessed initially by phone. Easy read information has been shared reassuring people that services are still open. Philip's experiences. Has been to hospital twice during lockdown in an ambulance. Both times he and staff agreed that he didn't need to be admitted. Really pleased that the staff had listened to him and spoken to him rather than his carer. Information consistently clear in the hospital. The staff on Ward 26 were fabulous. Christina to feedback Phil's story to the hospital. Part 3. Citywide AIS works for learning disabilities and autism. Health Task Group. The Health Task Group is part of Learning Disability Partnership Board and furthers the board's strategies about keeping healthy, which includes ensuring people with learning disabilities are informed about health services. Some HTG attendees have a learning disability or are carers. Some are representatives from LTHT, People's Parliament, etc. LTHT Learning Disability and Autism Team. LTHT has a dedicated page for learning disability and another for autism on their website. https://www.leeds.th.uk/learning-disability/. https://www.leeds.th.uk/a-z-of-services/autism/. There is a team at LTHT who support people with learning disability and autism. There has been some focus work carried out to develop easy-read resources to support patients with learning disability to understand their care and treatment in the hospital. For example, easy-read information has been added in relation to COVID-19 and breathing problems. A link to the easy-read resources. https://www.leeds.th.uk/a-z-of-services/autism/. nhs.uk/patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-patient-pat device so they can better understand the information being given. When carers can't attend hospital, staff try creative ways to aid communication, such as using video calling to their carer to help with the communication. The growing use of using hospital passports has been helpful. People have sent their passport to the team electronically, and these have been recorded in patients' record. This means people communication needs have been clearer to the staff team. Health Supplementation Scheme LYPFT works with health professionals to support their work with people with learning disabilities. Get Checked Out checklist for people with learning disabilities, setting out the questions the doctor will ask, helps people participate in their own healthcare. www.getcheckedoutleads.nhs.uk. Part 4. People with Autism's Experience. What autistic people have shared with Autism AIM. Some people have found it very difficult to get to grips with changes to GP services, etc. Some feel these changes have made GPs inaccessible, haven't received the message that surgeries are open, possibly drowned out in all the other information. When issues have occasionally arisen regarding reasonable adjustments, changes have been made by surgeries, but it has required advocates to get involved. Some people with autism feel easy read isn't for them, but information still isn't getting through. Some are behaving as if they are shielding when they don't need to. Anxieties around last-minute cancellations to services and not knowing when appointments will be rebooked. Some have not sought support for complex, long-term issues over lockdown and are now presenting with them. Fears about the safety of accessing services remain. Go to Autism AIM website for resources. http://leadsautismaim.org.uk/. LTHT notes that there are great concerns that people are still not presenting with issues, including domestic violence. Comment from Advanet. Could we provide photographs about what to expect when they have a health appointment? Know that GPs have done videos about what to expect when you go for an appointment, potentially need to be circulated wider. Communications have largely been created. This issue is that they're not reaching the people they need to. Proactivity is key. People with autism, in particular, can't be expected to proactively contact services.